Welcome to Think Like a Pancreas, the podcast, where our goal is to keep you informed, inspired, and a little entertained on all things diabetes. The information contained in this program is based on the experience and opinions of the Integrated Diabetes Services clinical team. Please discuss any changes to your treatment plan with your personal healthcare provider before implementing.
Hey everyone, welcome back to Think Like a Pancreas, the podcast. Today we're going to be talking about something that does not get nearly enough attention, and this is what it looks like to grow older with type 1 diabetes. My guest is Joanne Milo, who has lived with T1D for 60 years and just launched a brand new project called T1D to 100, which is a resource website for people aiming to thrive with type 1 diabetes in every decade of life. Joanna is also known for her long-running blog, The Savvy Diabetic, and helping to build the amazing Loop and Learn community. Joanne, welcome. It is so good to have you.
Thank you, Kathryn. It's great to be here with you. It's always wonderful.
Yeah, you're just so incredible. So you're just one of my favorite people, and just so glad that diabetes brought me to you and to be able to get to know you because of this thing we have to deal with every day. Is there anything that really sparked your desire to create this website?
Yeah, it's the way I look at all of this is everybody's on a journey. We're born, we live our lives, and then we kind of know there's an end game, and then we die. I mean, it's just a reality. And if you're doing that with T1D, it's just that much more complicated. And I think I was maybe in my 60s and started to have some medical issues or surgeries, and started to get a little concerned that I looked at the end and looked at my husband and thought, I don't have children. Who's there for me? What am I going to do? And I talked to a lot of people, and I started to hear older people getting frightened. They're frightened of being alone. They're frightened of what's going to happen, who's going to take care of me. And I started to look at that and thought, there's no answer. Nobody's talking about this. I pulled a group of friends, long-term T1Ds, to my dining room table, and we sat around, about 10 of us, saying, what are the issues? What are we concerned about? What do we think we need help with? And came up with a list. I chatted with Bill Polonsky and Paul Madden on a Zoom and said, I really think we need to pay attention to this. Bill said to me, well, what's the problem? You're living longer. Isn't that just wonderful? And the answer is yes, of course, we're very grateful. It's technology that's let us live longer. But the reality is nobody knows what to do with us. And no one knows how to comprehensively take care of us and make sure we are safe till end of life. And became real clear to Bill and to Paul, this is an issue and nobody's dealing with it. No one's looking at it. No one's setting up safeguards and systems that will work for us, and very little research. And so I thought, we need to do that. And we need to educate ourselves, because I've learned over 60 years, we have to advocate for ourselves. There aren't that many T1Ds total. There are more T2Ds, there are more people. We have to take care of ourselves first and foremost. And I'm used to advocating, and I'm used to being a loud voice and say, there's a problem here. So we met several times, and we made a list of things that we thought were major issues. I just started putting it together, saying, what do we do with this? How do we get attention? How do we get the research community lined up with us? And so I've connected very, very well with the research community. And then on a visit to my endo on a day, there were just issues, and he said, how are you doing? I said, I'm tired of this. I'm just overwhelmed. I'm tired of it. And he said, no, not you. And I said, yeah, I am struggling. And he said, I'm sorry to hear that. And then the appointment went on. It wasn't even addressed. Yet I was taking calls from people going, I'm scared. What do I do? And I thought we need to address it. So that was the beginning of the decision that we need to get out information. It's knowledge that helps us plan and at least not get caught by surprise. Purely informational, share the information, connect to the research community, and then educate the caregivers who really don't know what to do with us. And as an aside, I think they'd rather not deal with us.
Yeah.
We're not as cute as 10-year-olds, and we have far more problems, complications, issues, comorbidities, and we are complicated. We take more time, and it piles up and gets worse. So it's like, how do we prepare for that future?
Seems like so many providers just have thought of type 1 diabetes, of this juvenile disease, and for so long, just it seems like they forget that people with type 1 diabetes get old. And oftentimes, people with type 1 diabetes are diagnosed later in life. I mean, the amount of people I've met that weren't even diagnosed until they were in their 60s is truly, it's blown my mind. I never even realized until I started meeting so many people.
Well, I was diagnosed in 1965, and at that time, most of us were told we would not live past age 40. And I'm
Terrible.
71, so it, that number has gone by the wayside. But we weren't expected to be here. A lot of women were told not to have children because of the stress and the difficulties without the technology that just wasn't even thought of at the time.
Mhm.
So we've got a lot of agers who are kinless. They have no next generation. Yeah, we are living longer. There are way more being diagnosed as adults. And actually, I think the statistics I recently heard through Break T1D, there are more adult T1Ds than children. So
Yes.
we've tipped the scales, and the over 60 crowd is a fast growing demographic. We're still here,
Mhm.
but nothing is really prepared for us coming on in such large numbers.
Yeah. Yeah, it seems the only way where they've really paid attention to the adult population is with a lot of the technology. I mean, majority of the things we use work better in adults than they do in children, but
Mhm.
kind of beyond that point, it's just like a forgotten age. So, in coming together with the group in your dining room table, what were these ideas that flourished as you guys discussed?
We were furiously taking notes, and it boils down to, there are a lot of parts to it, but it's basically, who's going to take care of me? How do I get prepared for emergencies, falls, all the things that change of your living situations? Where am I going to live? And
Mhm.
what does that look like? What's going to happen to my body? And the more I hear, the more things are blamed on T1D and long-term T1D. Doctors aren't always screening for it. There are lots of issues. How do I keep coping? As you age, as anyone ages, things happen to you. You know, you get conditions, you get new diseases, you have falls, and how do you keep bouncing back emotionally? As you age, as anyone ages, there's loss. You lose your driver's license. You lose your ability maybe to live alone, or cognitively you lose your grasp on things. And how do we're trained to control our diabetes. That's the big word, is control. How
Mhm.
do you do if you're getting tired, you're cognitively a little bit off, you miss a step when you're doing your insulin infusion changes? That's all real frightening. And then what happens if your support network isn't there anymore? Partners die. Um,
Yeah.
Children don't support aging parents, and the technology is confusing. And then you have systems, you have healthcare and hospital systems that really are just beginning to understand, don't pull devices off of people when you're in the hospital.
Yep.
Listen to the patient, but that's not everywhere. And so we're saying, don't pull devices, work with whoever's taking care of you in the hospital. let's know that it is type 1 diabetes, not type 2 diabetes. I've had several hospitalizations and surgeries, and I finally said, I think we should have a wristband, a paper wristband like they give you in the hospital, say fall risk or allergic to penicillin. I wanted one that said T1D or type 1 diabetes. And I
Yeah.
asked the local hospital, and they said it would take 5 years to get through compliance to order wristbands. So I ordered 500 of them for $75, had them printed. Anytime I go to the hospital, I put it on. I share it with anyone who wants one of them. It's easy to
Brilliant.
do. And the last time I was in the hospital, I was in pre-op, and I said, "Excuse me, do you mind if I put on my wristband?" And they said, "You don't need that. We understand." And then they went through their questions, and they said, "I see you have type 1 diabetes." And I said, "Yes." And they said, "Do you need insulin?" And I thought, they don't understand. That's what the wristband is for, because if you can't speak, you can hold up your wrist and say, "Hey, look at this. This is important." So
Yeah.
it's all these safeguards and tricks and tips that we can share in our community just to make us safer. Um, then there's stories, people's stories. We want to know how people do what they do as they're aging. One lady I was talking with, and she living a lovely life, and suddenly her husband had a stroke and died. And she said, "I always thought I'd go first. I think that's what we all planned. Our caregiver will be there. We'll outlive him." And
Yeah.
it's no guarantee. And we've written about her journey. We interviewed her, and she's the epitome of one of the fears we have is what happens and how suddenly does it happen? And how can you be aware? She didn't know what the passwords were to get into the computer. She didn't know he did the finances. And we interviewed her, and that night, both of us who interviewed her couldn't sleep, going, "Uh-oh,
Yeah.
we need to be better prepared for this." You don't want these things, but they do happen, and they will happen. So everything we can do to share that and help people be resilient in this journey, it seems just essential at this point for us.
Yeah, absolutely. And it really is like going into assisted care, having that plan in place makes such a big difference. Like it's not fair to go in and have to give up what you've been using for years because they'll only allow you to do MDI or um take over that control of how you want to
Oh, and
navigate things.
put you on a sliding scale. Oh my gosh. I learned a lot about options for living if you aren't able to stay in your home or you don't want to. Some
Hmm.
places have a huge surcharge on type 1 diabetes patients. They don't want them. If they do, it costs more. I heard someone gets charged per injection. I've heard others where they don't have night staff that is authorized or certified to deal with a type 1 diabetic. So if you say, "I have low blood sugar," they call the paramedics instead of giving you some juice. It's an education process, it's a change of the system, and it's also critical that we have allied health providers who are knowledgeable about this disease and can understand the devices and help us.
Hmm.
We will need help, and there's a real lack of prepared people and the issues of liability if I touch your pump. So how do we make sure we're safe as we age?
Yeah, it's such a big thing that the website is, I mean, that's a huge start, but we have to get that to these healthcare providers because they need to make a change. We can be super prepared, but if we grow old, we lose our family members, even if we have a plan and they're not willing to follow it. What are we gonna do?
Parents whose kids had they took care of the kids as type 1s as children, and they needed to be taken care of. And then the kid goes to college. This parent with all this knowledge is kind of put out to pasture. Their knowledge is not being used. How do we use those people to provide support for an elderly person who can't quite remember how to put on a CGM?
Yeah,
Um,
and
even sit there step it through.
And even if these people weren't like, licensed providers, how can we get them to help? I see how that could make such a big difference because, of course, they know how to insert a CGM, and um,
Yeah,
they would be excellent to join the team of, these facilities.
right. There are
So,
not enough, and there's certainly not enough allied professionals that we need more help. And with this demographic coming on so strong, it really needs attention because people will not get the support they need. And they'll end up in the hospital. And that's
mhm,
another burden of cost and burdening the system that doesn't have to happen.
yeah. I wonder, did any ideas come out of ADCS of like what we could potentially do to better prepare like our, hospitals and long-term care facilities and places like that?
Not not yet. I think it's beginning. I was on a meeting last night with my team,
Mhm.
and it was last night, and this morning I got an email from one member saying she spoke to another diabetes educator, and they're looking at how to provide that kind of care. So it's beginning, and it's
Mhm.
going to come our community, and it's going to be to keep pushing the educators, saying you have the skills that we're going to need. You can make money here. It's
Mhm.
okay. You can get coverage, but we're going to need the help, and we're going to seriously need it. And people can do well on their devices for a long time, uh, but a lot of people are going to need some support. And it
Mhm.
gets bringing back to the what are some of the issues as you physically age. Sometimes it's hard to open devices, and I've had difficulty opening
Yeah.
CGM containers. Have arthritis, and you know how do we make those things easier? The other issue that came up, and I didn't understand it was an issue, but it is physical geography. Someone mentioned it in our early meetings, and so I don't know what you're talking about. We've been poking ourselves for 50, 60 years with needles and infusion sets, and we've been the CGMs, and our skin is damaged. Our skin gets thicker as we age. We lose the fatty layer. Um, where do we stick the devices? And so we came up with an amazing document called Skin in the Game of all the community input of things they use that make it easier for your skin to handle all these devices. A local university and their Department of Dermatology, because the head of the department is a T1D,
Mhm.
and um, is it, how do we validate that this skin thing is a big thing? I'm running out of spaces. I've used that for so many years. So um, it's just shedding the light on that it's different now for us. There's another area that we can touch on briefly, but digestion and the way our bodies handle hypo and hyperglycemia. Lots of parts of this, and we'll be doing some seminars on it, but bringing your blood sugar up from low sometimes doesn't work the way it used to.
Right.
Bringing down doesn't work the way it used to as we aged. Let's get the knowledge out and the tools that say, all right, it's changed. Here's the new way we do things, and just education.
Yeah.
And
And not even dish digestion. Have you noticed changes with insulin impact? Like,
absolutely.
yeah.
Yeah, it's your body is shifting and changing, and the liver is involved, and your nervous system. So digestively, I did a presentation a few years ago with some experts at Stanford on digestion, and it's a tricky issue that nobody wants to talk to and
Mhm.
talk about. It's unpleasant. It's important, and probably 50% of long-term T1Ds are dealing with gastric issues.
Yeah.
But we don't want to talk about it. Neuropathies are things we'd rather deny, but they are real. And particularly this first wave of aging T1Ds didn't have the benefit of better control, better technology.
Mhm.
So may be subject, beside the disease, to have more issues and complications. So
Yeah.
how do you handle it?
Yeah. Yeah, complications in general are just so hard to talk about. And it certainly makes people feel ashamed or embarrassed or, there's just so many words and yeah, they don't
Right.
want to talk about it.
Just don't
Um,
want, yeah, I just don't want to go there. I don't want to
mhm.
involve my spouse. I don't want to talk about it, which is totally understandable.
Yeah.
I had that discussion this morning with my husband because we talked last night, and he said it's the first time I really understood an issue that I was having, and I said I don't like to talk about it. I don't want to sound like complaining. But it's real, and I'd rather not say those words out loud. Um,
Yeah.
but they exist. So maybe if we can share on a website or a Facebook group where people can actually feel safe to talk,
Yeah.
it will help us understand and get some solutions that make it a little bit easier and feel like part of the community.
Yeah. I think everything for most people, everyone is different, but for most people to feel like they're not alone, they have support, they have the ability to find a community going through the same things as them makes
That
such.
actually is probably the biggest thing that has come out of this, and it's not
Mhm.
new, is community and social interaction. We just published a news article about like super agers, the people that live long, and they have studied super agers, and it isn't what they eat, it isn't what they do, it's their connection to community. That is their central point is stay involved, stay connected. Even if you're an introvert, stay part of a community. You benefit so much that it becomes essential. So we just put out a document on how to start your own support group. How do you find a dia buddy? How do you reach out? Um, I met somebody who at the age of 60 had never met another T1D, and we invited him to just a little coffee group that we had, and he sat there with eyes wide open going, oh my gosh, you guys understand. And he's the one that came up with the name T1D to 100. He said,
Oh,
I think maybe I can live longer. And it was this awareness that I'm not alone. It's a
yeah.
very lonely journey because everyone's diabetes is different and unique. But you don't have to be alone. You don't have to do it alone. And so we're 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 really pushing the concept of connect in any way. We have the resources of the communities that are open for groups and group walks or gatherings.
How do we keep people connected when they get to 80, 90, 100, kind of when they're at that point that they can't get out so much anymore?
Yeah. Well, thank
Zoom?
goodness for Zoom.
Yeah.
There are several Zoom events that are so warm and welcoming. Discussion yesterday on how do you keep them positive, because very often people like to talk about the dramatic events that happen or the injustice and things that don't go well, and that has a place. In a group, there's a sense that you can be uplifted in a way and at least not feel so alone. It's like you come away, go, yeah, I get that. They understand me. And
Mhm.
so it's interesting as you get into your 80s, you are more isolated.
Mhm.
That's something we're going to have to address is how do we reach into those people as well?
Yeah.
Social media helps. And, and I'm seeing groups with, 50 years plus, and they people join and go, hey, I'm here. And it's a whole interesting awareness of I have somebody to talk to and listen
Mhm.
to and be part of. So
Mhm.
it's so essential. Not just diabetes, but um to live well is connection, and particularly with this disease, which is so hard. People live well with this, but I always say it is a tough disease. It is
Mhm.
constant. You didn't ask for it. You don't get paid for it. It costs you money, and it's unrelenting. How do you keep going? And it's talk to others that are doing the same. It
Yeah.
helps.
Yeah,
Yeah.
I totally agree. I think doing it alone is really difficult. Finding the community that also lives with it is what makes a huge difference. Because, talking to people that don't live it, I think most of us get frustrated. I talk to people about diabetes all day, but my family and my friends are totally clueless. I mean, no way could I ever trust them to do anything for me. So,
That's interesting, and it's not unusual at all, and it's okay. I don't particularly want to know what their problems are either. I don't live their life,
yeah.
and I don't like to feel elitist. Like if you don't have T1D, you don't understand. The bottom line for me is you don't understand. You can't possibly understand what 24/7 feels like as a T1D. And I used to say we're 24 hours away from dead, and a doctor reminded me, "No, you're actually 6 hours away from dead." I said, "Well, thank you for that, but
Yeah.
it's a dangerous disease. It's so very constant that to connect with others who really truly understand, not to take away from the support people, the spouses, the parents. They have a different journey.
Yeah.
I don't know what it's like to be a parent of a child with diabetes, and I didn't understand what my parents went through. And I think I was 35 years old when I finally thanked my parents for the support they gave me, and stopped being angry at the whole thing. So
Mhm.
um, it's a different journey.
Yeah. Yeah, it really is. Where you're at right now.
Before we dive further into today's episode, I want to give a quick shout out to our sponsor, Tempramed, makers of the ViviCap device. If you use insulin, and who doesn't use insulin, you probably already know how sensitive insulin can be to temperature changes. When insulin gets much too cold or too hot, it can lose its strength, and that means higher blood sugars, along with all the fun symptoms like headaches, drowsiness, hunger, bathroom trips, and even blurred vision. What's tricky is that those unexplained blood sugar swings can often be linked to insulin that's exposed to the wrong temperatures. That's where the ViviCap can make a real difference. It's a simple, pocket-sized device that protects your insulin pens in extreme temperatures. No charging, no ice packs. Just pop your pen inside the cap and it's ready to go 24/7. The ViviCap is FDA registered, TSA approved, and built for everyday life or travel. It's super easy and super flexible. So if you want to take one more variable out of your diabetes management, check out Tempramed's ViviCap at tempramed.com. Now let's get back to today's program.
What are some things, and I know you recommend this on the website too, but what are some things that you have prepared for aging? I think you talk about like your emergency planning and, what you have for that. You talk about like health and wellness. So, what would you like encourage people?
The primary push that we've had for quite a while, all through COVID as well, is a go bag. And what we've put up on the website is a checklist of what you put into your go bag.
Mhm.
And the urgency is just make a go bag. Just get a backpack, get a bag you like, anything that, we say waterproof because you may be in a place where it's raining, as you well know today.
Florida.
Uh, or that's large enough to hold 2 weeks of supply, because what if there's an earthquake? What if there's a tornado and you have to get out quickly? You have to go to the hospital, grab your go bag, grab your insulin from your fridge and go, instead of having to sweep it into a bag or figure out what you're taking. It takes less than an hour to put it together.
Yep.
On the website, we have pictures of people's go bags. They come in all different colors and directions. I did a Zoom with Nicole Johnson, who was the first Miss America, wearing an insulin
Yep.
pump. And we talked about go bags, and she showed her go bag, which was this beautiful tote bag with the logo of Miss America. And I said, you don't want to use that because someone's going to steal your bag. They don't want the it's a beautiful bag, but whatever is durable enough that you can grab and go. And even if it's not an emergency. Suppose someone calls you and say, I have 2 tickets to go to Paris. Do you want them? You have to leave in an hour. Just
Oh, yeah.
grab your bag. You can
Yeah.
get, it doesn't have to be a drama. What came meeting last night was you can also set up a mini go bag. And I'm beginning to realize how important this is. Anytime you leave your house and you're going to be gone for more than an hour,
Mhm.
what if your insulin infusion site fails while
Yeah.
you're out? What if you get a flat tire and you're waiting for the tow truck and you need to change something? A little kit that has insulin, infusion set, syringes, and and sugar. Grab it and go. Too many people who should know better don't have these. They say,
Right,
"I won't be
exactly.
gone," and don't know if you're not going to be gone long.
Right,
So,
exactly. And you never know what's gonna happen. I mean, and this is for all ages. This isn't even just for the aging population. I mean, everybody, I think, should have this go bag, and I love the name. I just love it. It's go bag. But yeah, I mean, I have, like, a little pouch, but I do forget to grab it sometimes, even though it's literally hanging right in front of my door. So,
mhm.
also, like, you mentioned syringes. I mean, keeping syringes, like, everywhere so that, like, for me like, me, if my pod's gonna fail, I'm gonna pull my insulin out of my pod and inject until I can get home.
Diabetes is stressful enough. Don't let something that's not in your expectation happen and then
Mhm.
make your life a little bit worse when all you need to do is go get this cute little bag and carry it
Yeah,
with you. It's
yeah.
not that difficult. It is a reminder that you have diabetes, but that's not the point of it. The point of it is to reduce stress, and that things are unforeseen because you don't foresee them. They happen when you don't expect them and don't need them or want them,
Mhm,
and it just takes the away of stress just a little bit. So
mhm,
we have checklists for go bags. I also always recommend have your medical data in one place, how you take care of your diabetes, the medication list that you whatever it is you take, how
mhm.
you take when you take it, um, the list of your healthcare providers. So if an emergency comes up and you end up in the hands of a medical environment, you don't have to remind them what your surgeries were or what your medication are.
Oh,
It's right there.
mm,
So
yeah.
we have pages that you can fill in. You can scan them in and put them on a flash drive. You can load them on your phone. There's a way also. So that's what we call a personal medical resume. Just have your stuff in one place, updated
Mhm.
every 6 months. And maybe we'll put a reminder on, it's time to update.
Yep.
Um, just when you have the stuff available and ready to go, set
Mhm.
your people have mobile phones these days that you can set up Android or iPhones for emergency access. Most people don't know that. And so we have instructions for both phones on how to access that and put in emergency so emergency personnel or anyone that is helping you can get to your information.
Mhm.
So it's just tips and tricks and things that we don't think about, but as a group, we have thought about them and we're
Yeah.
adding things to
Mhm.
make it easier. It's hard enough. So,
Yeah. Yeah, thinking of, like, this emergency folder of our information just is so helpful because, a lot of the healthcare systems, they can eventually access all of your historical things, but that takes time. It's not like they can just hop on and right away they have all your history, but if you bring it along, like, you're setting yourself up for potentially better outcomes.
yeah, I have a little clear cover, little binder, and there's one in my car, there's one in my go bag. When I've been in the hospital, I put it on the nightstand and it says, read this. I have type 1
Brilliant.
diabetes. And it's big and it's bold. Whether they're going to read, I don't know. But if they come in and ask a question, you can refer to it, say, hey, these are my settings on my insulin pump.
Mhm.
That these are the medications I take. These are the ones that are essential medications, not just supplements, because
Yeah.
they don't know you, but you know you. And
Yeah, but also you can't speak clearly for yourself a lot of
no,
times in a hospital situation. So
and even
you
for
thought and
your advocate may not know all the details.
Right. Exactly. Yep.
It takes a little preparation. I don't know how to help people carve out the time to do it. But I think it's an intention that you say, I just want to feel a little safer. I want that problem to be gotten rid of. I'll take a half an hour and pull it together. It's a planning thing. A lot of people don't like to plan, and I understand that.
Right.
But a lot of people don't like stress either. Let's see if we can
Yeah.
What's the stress? Aging alone is stressful because this topic is difficult. It's just really, really difficult. Nobody really wants to face the fact that we won't be here. As far as I know, that's a reality, and we will all be on that path. So one more topic, and I think it's just important to say real quickly, towards end of life, and if in hospice care, this is something I just learned. There is a thinking that you withhold insulin at end of life. And that is possibly the worst advice that can be given. Now, I never thought about it because I didn't think about that part of life. You will end your life, but it will be a bad way to go. So you should have written into your wishes, do not withhold insulin.
Yeah.
But it happens. So this is all just trying to make things as easy, least stress, and make you feel as good as possible for all the days you have left going forward. Yeah. It's be set up to succeed and to be as happy as possible because that's what you can do.
Right. Yeah. That's in our own control. What are some things that you think, just kind of in all of your discussions, has been like, have you found any trends for what has helped lead you guys to aging so well with T1D? Because I mean, I look at you, I know you go to Pilates and you are living like a great life from a physical activity standpoint, and you're enjoying the things that you want to do. Is there, like, do you feel like, there's things that you did that led you to be able to age so well already, even, you didn't have all of these tips. So how'd you do it?
The overriding thing for me is to try to live as best as possible in gratitude. I am, when things go wrong, and quite honestly, they're going wrong at a faster pace than I can actually keep up with. But when they do go wrong, I very often go to, but I'm still lucky. First of all, I live in this century, not the previous century where the technology wasn't there, or I'm grateful that the sun is shining. I sometimes have to reach for the gratitude, but it just kind of makes me feel better. All the research says keep moving. Just if you look at anything on the zones or what the long agers do, they keep moving. Don't sit and watch TV. Somehow get up and move and interact. And so also stay connected in the community. In my Pilates class, I've heard instructors say, we do this exercise not because if you fall, it'll help you get up, and it's when you fall, it'll help you get up. As we
Yes.
age, we have nerve damage, we have proprioception falter, and we are far more prone to falls. If vision issues or you wear bifocals, you're prone to falls. If you're used to charging through life and you go fast, you're going to fall. It's all these little parts, and you don't want to fall because that will set you back. So be strong, or make sure you have some level of fitness because that'll help you get off the floor if you fall.
Yeah.
And as we age, very often we don't hydrate. That's a tough one to kind of make that habit, but make sure you're hydrated. Drink whatever fluids you can, but just make sure you hydrate. They're basic things, and I guess the other one is sleep. Sleep can be challenging as you age. There are issues of sleep apnea and what those are, but take care of those things because sleep is essential. It's where your body builds, recharges. So the basic things, but you can get overwhelmed and not do them. So maybe we can, as a community, help each other stay on a healthy path.
Yeah, yeah, absolutely. I love, help each other and hold each other to
Mm.
that. But yeah, I read when I was probably, I want to say like 18. Gary Kohlberg wrote a book. It was like 50 Secrets of the Longest Living People with Type 1 Diabetes. And I found it to be very inspiring. Some of the stuff now is, it's an older book now, but I think the overall message is still so important from what you get out of it, because that's pretty much what the book says. These
Mhm.
people have stayed active and made physical activity such a, like, given it such a spotlight in their life. So definitely.
Make it as possible. Reward yourself if it isn't
Yeah.
a thing you like to do. Find the things that you do like. These are all the things that are out there, and you hear them. How do you make them part of
How do
your
you actually
life?
do it? Yeah.
Yeah, yeah.
Mhm.
Actually, put on your calendar. And if you don't keep a calendar, keep a calendar. And I write in the days I have Pilates class, and I write in days when I have activities.
Mhm.
It This is all the smart things. It's not whether you have diabetes or not. These are just the smart things, but particularly for your cognition and your well-being with diabetes, because you do take care of yourself. I told the group last night, anyone here who's lived with this disease over 50 years, you've done something really well. Really,
Mhm.
you know how to organize yourself. You know how to pay attention. You know how to live in reality and take your medication. So kudos, you did a great job, and just keep doing that and feel good that you actually have those skills that
Yeah.
got you to 50 years. And that was no easy feat. It's like these little celebrations, these little milestones that you reach.
Yeah.
Appreciate your for that. Absolutely.
Mhm. Yeah, I love that they give those, like those little coins, those milestone coins. I know Friends for Life does it. I think there's some other places that give them out too.
Boston does.
Yeah,
I have them all myself. Um,
yeah, right? I look at mine, like, yeah, that's a long time. Yeah.
Jocelyn used to give a gold watch when you hit 50 years, and I was so looking forward to
Whoa.
that. 'Cause I go to Jocelyn in Boston every Christmas. I would go there to readjust my insulin needs, and it was a hard time as a teenager, but it was smart. But when I got to 50 years, I'm going to get my gold watch. And they stopped giving gold watches because so many of us were living that long. I went, wait, I was out of
Wrong.
my watch. And so then they give you a brass medallion. It's not a gold watch, but
It's not, yeah, that's
it's
not the
still an,
same. We need that gold
it's,
back. That's,
yeah.
yeah, you need that gold. You need a gold watch. You do. You
Yeah.
have most certainly earned a gold watch. I think we need to make that happen again. And gotta get you
My
that gold
husband,
watch.
he actually bought me a vintage space watch that was created in the year that I was diagnosed with diabetes. It was a 1965 watch. So it's a vintage watch for my 50 year. Because he goes, okay, you didn't get your gold watch, but here you go.
Oh my
um,
god. That is
you have
amazing.
you have to celebrate and realize how well you've done. Days are not easy, and there are other days that are really not easy. That you get through them is remarkable. I also think a lot of how we've done so well is because we do pay attention to exercise. We do pay attention to food. It's been something that's been drummed into so many of us. So I wonder, if I didn't have type 1 diabetes, um, would I be overweight? Would I see my family who don't have T1D, and I'm
Mhm.
healthy. It's a reminder, and that you're doing it again. Celebrate that. It's
I remember, like, growing up on cosmic brownies and oof. So, yeah, learning about the food, never I don't know that it ever would have happened without T1D.
sometimes we'll go get a sandwich, and he'll come back from buying the sandwich, and I'll have a candy bar, and I'll start eating the candy bar before lunch. I go, I don't understand why you're doing that. That's no, 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 no. And he goes,
Mhm.
well, I like it. And and we maybe have a little more control on that. I'll have a bite after lunch, but first I'll
Yeah.
eat my food. So I said, you just don't have diabetes now, do you? And just he said, well, I was
Yeah.
hungry. I understand.
Most of us did learn some really good health habits
Mhm,
because of type 1 diabetes. So,
mhm.
yeah. Yeah. And I'm
Por-
definitely grateful for that.
Portion size. I learned that at Joslin Clinic, and I mean, it was so detailed that they would cut off pieces, like parts of a piece of bread, so you have the right number of grams. I went, well, that's a little extreme, but some people did that.
Mhm.
Understanding portion size and consistency, and a lot
Yeah.
went into what got us here this many years down the line.
Mhm.
You also learn long term, you can do everything right and not get the result you expect. This disease is capricious. It is unexpected,
Rude.
unreliable. Things happen. I watched a little video reel of a little girl saying, "It's not perfect, but you can be as good as possible. You can do the best you can." And it's an understanding that it's not you're not going to be perfect every day. This disease doesn't let that happen,
Mhm.
uh, and yet you can keep going. So it's just that awareness.
Yeah. Yeah, absolutely. And I love that little girl was saying it.
Yeah, it's just that reminder that this disease doesn't let you be perfect.
Right.
Uh, It just doesn't. Life doesn't let you be perfect. So,
Yeah.
the disease just follows that path, and
It sure
you know,
does. You do
yeah.
everything right and everything goes wrong.
Mhm. And there are days where you can explain it, and you don't try not to beat yourself up, and you try to get back on track, and you give yourself some grace on that period of time.
Mhm.
Yeah.
Yeah, absolutely. Giving yourself the grace. It's just such a good way to say it, but it's what we have to do. Have to give ourselves grace with
And maybe
diabetes.
with a touch of humor. It is all if you were sitting 100 feet above watching everyone on earth doing all these things and getting all stressed, you'd say, "Oh, calm down, it'll all work out." Just
It'll all
kinda
work
get
out.
some perspective of it
Mhm.
it will work out or it won't, but stressing on it doesn't bring it any easier, make it any easier.
Yeah, it doesn't
Yeah.
change it either. Getting upset, if anything, is just going to make it worse because you got some stress.
Yeah, it'll just make you need more insulin. So,
Yep. Yeah.
yeah.
Yeah. I love the pages where they use humor to kind of cope with type 1 diabetes. That's my type of people. That's what I like to use. So,
It's sometimes a little dark humor, but it works.
really. So, yeah. It's just makes everything, I don't know, humor makes everything a little bit easier to
It
manage.
does. And I think you bring it back to just community sometimes helps you see the humor in it when you just are so deep into this is horrible. Somebody
Absolutely.
giggles, yeah, but other side
Yeah.
it's kind of so it's helpful to have other perspectives sometimes.
Yeah. And you, I have to say, are just so absolutely incredible at getting a community together. I know you have a Facebook page for T1D to 100. The Loop and Learn community is just, of course, I've been a part of that for a long time, but it's so amazing. It's like you did that. Like it's just so I can't wait to see what the community becomes for, the T1D to 100. I just see
We
it growing.
we've been up for 3 weeks. The Facebook group is growing. It's faster than I anticipated. Um, we're touching a nerve of people who are saying, "Yeah, you're right. I don't know what to do as I age. I need help." And um, people are just coming out saying, "How do I help? How do I get involved?"
Mhm.
And we're looking at a group that focuses on advocacy because we do need to help organizations and hospitals understand what we need. We need nursing schools to understand what we need. All of this is advocacy. We need some pressure on fundraising organizations to acknowledge that we are a large group of people. Most of the large groups that do fundraising don't focus on aging.
Right.
we're not as cute on as poster
I think
children.
you're absolutely adorable. So I disagree with that one.
But we're just not the cute little kids that they parade out. Maybe they should have them all come out with walkers. I don't know. We need a place at the table in congressional pressure and making changes. Otherwise, changes will be made, and we don't have a seat at the table. So we are pulling together an advocacy effort, trying to get the voice loud enough to say, pay attention to this demographic. We're not huge. We're not type 2s, and even they require that advocacy. So part of the things we're trying to do as well.
Type 1 is so incredibly unique, and right now there is not nearly enough taught in school about it. So it's like it either needs to start getting taught so that people can be better cared for, or we need to come up with a way that we can get those people that were parents of a type 1 to be able to go in and help people. Some kind of easier path than becoming, getting these certifications or whatever is necessary now.
Yeah, and certifications would absolutely help. It would kind of regulate the knowledge base, so everyone's kind of on the same page, and it would reduce liability. People are there, the people have the knowledge. With more and more people aging into this category, the help is gonna be needed. There has to be a change in the system, so we advocate for the change. Hopefully, we can get into the nursing schools so that they teach the proper information. A lot is still being misinformed. So it's
Yes.
education, it's community again, it's having a voice and sharing that. And it's our goal. And I kind of have a three-prong approach, which is help the T1D. That's my primary, help my people age gracefully and as happily as possible, then interact with the research community who will validate our concerns. They'll study it. They'll say, what are you concerned about? I'm speaking at a conference next week at Harvard Joslin, and my husband is as well because he's the caregiver of a T1D. So let's get the voice of what our needs are, let them research it, validate it, and let's take that into the healthcare community and saying, this is the reality. This is how you need to practice the medicine. This is how you to provide care. So it's a kind of a three-prong approach, and that's our goal is, be loud.
It's so good. Like, thank you so much for having such a great voice that you're willing to travel to these places and give these talks and create these sites and make the difference.
We're all the expert. We are the experts. You can't live with something 24/7 every single second and not come away with some expertise, and that we can share it and that someone's willing to listen and make changes for us is really pretty essential, so that we deserve to be safe. We deserve to be taken care of as we need. And we have to help those who are going to do that understand what those needs are.
Absolutely.
They don't know, we'll help them. I mentioned in my talk to ADCES, just ask us. Ask anybody who's lived with this disease for a while. We'll talk to you. We have a lot to say, and we will help you understand what the needs are. So we welcome that opportunity. Some great researchers out there, amazing people.
Yeah. I'm really glad that you're going to these conferences and people are definitely hearing you. So
thank you.
Is there anything that you feel like everyone with type 1 diabetes should know? If you could tell everybody one thing, what would it be?
Top of my head, make a go bag. I think it's kind of check how well you're coping with this, because it's so constant, and keep on track. It'll help you happily make your go bag. It will help you stay level when you're talking to your care providers. This disease is hard. And so how do we make it easier and help each other? stay connected, eat food you like periodically that isn't on your list. Just be as
Yes.
happy as possible and but connect, absolutely connect.
That's great. I love that. So I think this is only the start, and hopefully the listeners today feel inspired. If you're a parent, your child's going to grow up and not have you one day. So, get involved. It's never too soon to get involved. I think that sometimes we forget how fast life can go by. Be the difference. It has to be, if you don't do it, who's going to? Joanne's going to, but we need to come together and do it. So hopefully we will, people are going to be inspired by you.
Well, thank you. I just hope people set some attention and say, yeah, we just need to make it a little better for all of us. We live in a kind of crazy world right now, and there's a lot of um,
Mm.
concern and unhappiness, but we can do something about this stuff that affects us so directly and others who need our help. So reach out, be part of the community, and come visit us and ask us what your questions. We're on Facebook right now. We're growing. We're on Instagram. I'm learning about social media.
Mm.
Also on LinkedIn. So we're trying to get the word out that we're here.
And where do they find you? Can you tell them what the social media pages are called, and also what's the website URL? We can link it in the podcast description as well.
They're T1D2100.com.
Yep.
Put that in, you'll find us. Just so you know, doing our graphics for the website was a real interesting exercise in what is the image and the essence of what we're trying to convey to the community. And it's that we're on this journey. Everyone's on a journey. It's their own journey. And it's like a river, and you can understand it's going to flow. It's going to take a lot of funny turns. And sometimes you'll have running streams, and you'll have rocks in there. And you're on your own journey. Make that journey as smooth as possible, as understandable. And if you get thrown out of the canoe, get back in the canoe, or whatever your way is of navigating. How do we navigate this together and be as safe as possible and enjoy the journey as much as possible? That's the goal. So we have this sense of kind of like a river, and that's kind of our goal of we're all here. We're all doing this. So let's do it as well as we can.
Yeah, and that's like the perfect imagery of everything you just said. Like, I mean, what a great quote and image to give to everything. And the website is beautiful. It is very nicely done. So
that was a project of passion to figure this one out.
yeah,
People feel safe in it and enjoy what they're reading and learn.
Yeah. Well, I really enjoyed this conversation. It's always such a pleasure to talk to you, get to hear about what you're doing, and you're truly incredible, and just greatly appreciate your time.
And thank you so much for what you do in our community. So it's wonderful.
Thank you. Thank you. Well, and thank you to our listeners for joining us today on the Think Like a Pancreas, the podcast. And we will link Joanne, the T1D2100, all the social media platforms, and we'll link the website in the description. So make sure, if you haven't seen those, check them out, join the social media pages, and come on, engage. Joanne's going to be very welcoming on those platforms. So thanks again for listening, and we'll catch you next time.
Thanks, everyone.
Thanks for tuning in to Think Like a Pancreas, the podcast. If you enjoyed today's episode, don't forget to like, follow, or subscribe on your favorite podcast app. Think Like a Pancreas, the podcast is brought to you by Integrated Diabetes Services, where experience meets expertise, passion meets compassion, and diabetes care is personal because we live it too. Our team of clinicians, all living with type 1 diabetes, understands the challenges firsthand. We're here to help no matter where you are in the world. From glucose management to self-care strategies, the latest tech, sports and exercise, weight loss, type 1 pregnancy, and emotional well-being, we've got you covered. We offer consultations in English and Spanish via phone, video chat, email, and text. Want to learn more? Visit integrateddiabetes.com or email info@integrateddiabetes.com to schedule a consultation. On behalf of Think Like a Pancreas, the podcast, I'm Gary Shiner, wishing you a fantastic week ahead. And don't forget to think like a pancreas.